Thank you everyone for joining us. Welcome to the latest Duke Media briefing on the COVID-19 pandemic. I'm Greg Phillips with Duke Communications. We have three Duke experts with us today to discuss whether schools can reopen safely and how that can be done. With us today is Dr. 𝐓𝐡𝐞 𝐏𝐚𝐧𝐞𝐥𝐢𝐬𝐭𝐬. She is an assistant professor of pediatrics in the Division of Pediatric Infectious Diseases at the Duke School of Medicine and a medical director of pediatric infection prevention at Duke University Medical Center. Good morning to you. Also joining us is Kristen Stevens. She is an associate professor of the practice of education, and she is co-director of a working group on education policy and president of the American Association for Gifted Children. Good morning to you.
Good morning.
And we have Dr. 𝐏𝐚𝐧𝐬𝐶𝐬𝐿 𝐏𝐼𝐬𝐬𝐿. She is an associate professor of pediatrics in the Division of Critical Care Medicine at Duke University Medical Center, and she's co-leading a pilot project funded by the National Institutes of Health studying the safe reopening of schools. Good morning, Dr. 𝐏𝐬𝐬𝐿.
Good morning.
And we'll start with you. Yourself and Dr. 𝐏𝐚𝐧𝐬𝐿 are among the co-authors on some new research on the incidence and transmission of the virus in schools. Can you please tell us a little bit about what you found?
Sure. So we formed the ABC Science Collaborative back in the summer of this year, or of last year, actually, and we're able to collaborate with several districts across North Carolina. Among those districts, there were about half who were entering a hybrid model of education in the first quarter of the year. And about half of those were going to go for, or went for all 9 weeks, and we're willing to collect data on their primary cases and secondary transmission as they went back to school. We were able to gather data from more than 90,000 students and staff who were in face-to-face instruction in this hybrid model, and were able to identify 773 primary cases of SARS-CoV-2, so cases that came from the community. With mitigation strategies in place, we identified that those cases resulted in only 32 additional cases of SARS-CoV-2, so secondary transmission of SARS-CoV-2, which is substantially less than the transmission that we would see within the community setting.
Okay, thank you very much. We're certainly going to talk more about that research a little later, but Dr. 𝐏𝐚𝐧𝐬𝐿, to move on to you, what did the research tell you about the kind of measures that schools should have in place to be able to reopen safely?
Yes, thank you, Greg. So some of it came from the research, but a lot of it actually came from the creativity of our school leaders in trying to use both CDC and state health department guidance that came out through a toolkit to ensure that they can create settings for safe in-person education. A lot of it had to do with the 3 W's, that's referred to as just washing hands, wearing a mask, and waiting 6 feet, because for the research we presented, it was a hybrid model, so 6 feet was incorporated into the plans for schools. And then, of course, having detailed guidance for parents, for caregivers, for the students across all age groups that are age-specific, and that grade-specific guidance to help with lunch, recess, extracurriculars, if they brought that back in, and just navigating the school day to ensure that you reduce the risk for contact, close contact, and spread in the school setting. We can go through some of the specifics. Some of them were generally applicable across all settings, and some of them were unique to the setting. So for example, special needs or exceptional children or children in adaptive curriculums needed something slightly different than what was in the traditional school pathway.
Sure, absolutely, that makes some sense. And we'll certainly dig into that some more as well. Professor Stevens, I'd like to move on to you. Could you talk to us a little bit about some of the teacher-specific concerns that there are about returning to in-person schooling?
Well, I would say of the teachers that I have the opportunity to interact with weekly, they're all very eager to return to school. They prefer to see their students in person, and they miss seeing them, and they know that the classroom in the traditional sense is the best place for students to be. In terms of concerns, I think they primarily have to do with instructional concerns rather than mitigation concerns. The instructional concerns, what I mean by that is we kind of have approached this problem from a binary. Either students are in school or they're attending class virtually. And what's going on now across North Carolina, as well as probably in many other states, is that there's sort of a mixture of the two going on, and the models that are being used vary dramatically. So the concern is, what does instruction look like? How do I need to plan based on the model that my particular school or district is using? And just to give you an example, there are school districts that have returned to in-person learning, but they're still allowing an option for parents who don't feel comfortable sending their children to school to have virtual learning continue. And in some districts, that virtual learning is kind of conducted separately, where they have a pool of teachers who teach just that way virtually to those students. And then there's other districts. My husband is a teacher, and in his particular classroom, about 25% of his students come to school and the rest are virtual, and he's teaching them all at the same time in the same classroom. And so that type of pedagogy and how you manage and kind of juggle when you've got students live there in person with you, plus you have a whole group of students online that you're delivering instruction to simultaneously, those are the kinds of issues that teachers are most concerned about, and having the resources needed to do that effectively.
Absolutely. Thank you very much. Thank you to all of our panelists for those brief opening remarks. So we have this situation in which teachers and students are keen to get back into the classroom, and there is some evidence that that can maybe happen safely, but of course there are also widespread concerns about what that might mean. So now we're going to open it up to questions. Thanks to everyone who submitted questions in advance. You can also pose questions via the Q&A window at any time. If you'd like to ask a question in person, raise your hand in Zoom and we'll unmute you when your turn comes around. If you're calling in by phone, you can raise your hand by pressing *9. So I'm going to start with some of the previously submitted questions. And Dr. Zimmerman, I'd like to come back to you. You mentioned in the introduction that you found much lower incidence and transmission of COVID in schools that you might expect. Could you talk a little bit more about what you guys think might actually be fueling that and what the reasons might be for the transmission to be so much lower than expected?
I think we know that the mitigation strategies work, right? They work outside of school buildings. That's, the CDC has recommended that we do the 3 W's, that we wash our hands, that we wait, and that we wear masks. We know that those things are successful in multiple scientific publications, multiple different settings. There is no fundamental reason to believe that that wouldn't actually work inside the school building as well. We know, however, that schools are really good at enforcing rules. And I think that that really is the difference. We talk to these superintendents, we talk to the teachers and to the principals, and they're working really hard to make sure that people are actually enforcing the mitigation measures. And I think it's due to their dedication and leadership that this has been so successful.
Absolutely, that makes sense. Thank you. Dr. Akinboye, one of the questions that we've had from multiple people is about what role testing should play in getting schools open again. Do schools need a surveillance testing program in order to open safely?
Great question. I think it depends. Of course, testing has been essential in the overnight setting in the on college campuses. So for example, you're bringing in a number of people across the country, young adults who are now coming into a dormitory style setting, studying together and also living together. In that context, it's certainly important to have perspective, so forward-looking scheduled testing to understand what's happening from where people are coming from, what they're bringing into that local community, and prevent potential clusters. For example, we've done that here at Duke University. The opposite is the case in K-12. So for the most part, except for certainly some private school, charter schools, and some schools that may pull in from larger catchment areas. But for the most part, a lot of schools are based at a district or city level, and are just a reflection of local communities. And so in that context, you have people coming in daily and going back into the local community, except if you're having before and after school testing, which is not cost effective or really practical. You're just getting a snapshot in time, and it may not answer the question that we're trying to address. Are we capturing all possible cases and reducing spread in school? However, I would like to add, in certain contexts, ensuring that there's an easier access for most kids. So ensuring there's equitable and easy access to testing, even if it's through the school, if it's having some of the rapid tests on site, or providing some context that can facilitate testing if someone does get exposed would be helpful. But that's nuanced, and it takes a lot more conversation and planning to ensure that testing is appropriate and useful for K-12 setting as compared to college campuses.
Sure, that makes sense. And there was a follow-up question attached to that I'd like to ask. And Dr. Zimmerman, please feel free to weigh in on this too. And the question is, with regard to testing in schools, can schools rely on the rapid antigen tests that are considered to be less accurate to guide them as they figure out the safety? Is there any evidence as to whether that will be sufficient or not?
The rapid antigen test has some limitations. It could be useful in the setting of picking up quick infections, particularly in symptomatic children. When we have asymptomatic groups the test may have a lower sensitivity in that population. And so we just have to be careful about what the test is, what the technology behind the test, and the numbers for sensitivity, specificity. And without going into the weeds too much, I think there are ways to ensure that the right test is used in the right population. If it's a rapid test or rapid antigen test, it may need a confirmatory PCR or polymerase chain reaction test to confirm positives, and sometimes even to ensure that your negatives are truly negative if it's a symptomatic child. So just going back to the original question, a rapid test may be useful. It depends on the type of test. Is it antigen? Is it PCR based? And then specifically, what's the population you're testing? Are you testing a symptomatic child or an asymptomatic child? Thankfully, the CDC also has an algorithm to help with interpreting test results and practically using them in that setting.
I think it's also really important, if schools are going to implement surveillance testing, to remember that these tests aren't perfect, as Dr. 𝐏𝐚𝐧𝐞𝐥𝐢𝐬𝐭𝐬 just mentioned. And so really adhering to the mitigation strategies is still going to be very, very important. Just because we have testing does not give us a free pass, because of limitations of the test, does not give us a free pass to kind of relax what we're doing, to not mask, to not distance, to not wash our hands, and to not be really super vigilant about these strategies. And I think that is a potential risk to have some kind of false security in the surveillance testing that should be thought of.
Sure, absolutely. Thank you both for that. Professor Stevens, I'd like to move on to you. You mentioned the difficulties and obstacles in having a blend of online and in-person instruction. And I'd ask you about teacher concerns. What evidence is there of the effect that being out of school is having on student development? But also, have there been any research, or is there any evidence as to what returning to school under different conditions might mean for the teaching environment in the classroom?
Yeah, I mean, I think that we all know that being in school in the traditional sense is the best for all students, because school is not only a place where children receive instruction, but there's lots of other services that children receive in school. And teachers I know are very concerned about not having that day-to-day kind of physical contact with their students so that they can monitor and see how they're doing, both academically, but also social, emotionally, and health-wise. In terms of the mitigation piece, and I said that teachers that's not their primary concern, but there still is concern around mitigation with regards to just the simple infrastructure of our schools. And they vary drastically. I mean, if you've driven by any elementary or even middle school these days, oftentimes you'll see the mobile classrooms that are situated on school grounds. And that's due in large part because we have overcrowding in many of our schools. And so if there is any concern for those teachers who have started in-person instruction, they say the students are very good at following the rules around wearing their mask and so forth. But it does become difficult when you have overcrowded classrooms to maintain that that 6 foot recommended proximity from one another. So I would say if all students are going to return to school, we need to have some strategies in place of what that's going to look like. Do we even have the infrastructure to make it possible for that distance between students and staff to be maintained?
Thank you. That makes a lot of sense. Thanks everybody for all the questions that are coming in. We're going to try and get to as many of them as we can. Dr. Zimmerman, I'd like to come back to you. We've had a question here that says, is it fair to reopen schools in communities that mostly serve students of colour and may have several teachers of colour when those communities have been disproportionately hit hard by COVID? And what particular guidance would you have for educators and policymakers in those communities? Would you say anything different?
So I think it's really important for us to understand the science. So we know, unfortunately, that communities of color have been disproportionately impacted by COVID-19, but that is largely related to the fact that many communities of color have family members, parents, et cetera, that are on the front lines and that are on the front lines potentially without appropriate PPE, et cetera. So when we're thinking about the idea of schools, just because someone comes into the building, even if they came from a community that might have been more disproportionately impacted by COVID-19, does not translate into a higher risk potentially of spreading disease within the course of the school building. Fortunately, COVID-19 knows no color. Fortunately, the mitigation strategies know no color. They have no idea who you are, what community you came from, or anything else. The assumption with the mitigation strategies, no matter what, is that everyone is infected. We should assume whether you came from a community of color or a community, a non-color community, that everyone is infected. And so we should apply the same standard, the same mitigation strategies, the same help, everything to everyone. We get into trouble when we start kind of parsing things out and trying to think or trying to decide who's infected, who's not, et cetera. We should assume everyone's infected. Therefore, the mitigation strategies within those communities, outside of those communities, should be sufficient.
I would also like to add, and I appreciate both Dr. Zimmerman's comments on the last question and Professor Stevens' comment previously. I would just like to highlight that people's experiences over the last year may have differed significantly, and that would impact their decision to choose in-person education or not. Some have thrived, some may not have thrived. And also knowing and seeing people infected, hospitalized, and dying from this disease may be different from seeing case numbers and numbers on TV, or being somewhat removed from the overwhelming COVID information that has spread over the last year. And that will impact how people come back to school and what that person looks like, what that student looks like, what that family has experienced over the last year will impact how they interpret the school guidance. And so we've encouraged and we've discussed with school leaders and appreciated their increased effort to understand the lived experience from the past year and explain protocols or have some level of flexibility within the protocols to allow for the different experiences and the choices people would like to make as they decide, as they're choosing the type of education or the type of setting for education the next few months.
Sure, thank you both. And Dr. Zimmerman, as a follow-up, I appreciate your explanation about how COVID knows no color and a lot of these are socioeconomic issues. One of the things I'm wondering is, obviously, for schools to reopen safely, we've talked about the mitigation protocols that need to be in place. And unfortunately, we know that even in a given district, schools aren't always equitably funded. And so, I mean, how important do you think it is for policymakers when they're putting mitigation strategies in place to make sure that schools are being consistently treated the same and that they've all got, the same resources? Because it seems like resources obviously could be crucial in making sure everything is in place.
Yeah, I mean, I think it's absolutely key, right? Like, it goes back to my statement about treating everyone equitably, no matter if it's the individual or if it's the school or if it's the community. So I absolutely think that is really, really important. And we have a long way to go. We know for many years, schools have been underfunded across the board, and in some cases, particularly in communities of color. So thinking about how to do that is very important. But fortunately, some of the things like masking, hand washing, et cetera, don't cost an exorbitant amount of money. Certainly things like space are going to be important. There are some schools without running water or warm water. And so those are the types of things that definitely need to be addressed. But we're not talking about entire overhauls in order to allow people to be able to go to school safely.
Sure, that makes sense. Thank you. Professor Stevens, a question for you, and also I'd like both the other panelists to weigh in on this. But from a teacher perspective, we've had a number of people ask about the role that vaccination should play in reopening schools for in-person instruction. Should it be a prerequisite? If so, why? And if not, why not? Professor Stevens, I'm wondering if from the teachers that you're talking with on a regular basis, how much of a concern that you're hearing that is from teachers? And then from our two physicians, I'd like to hear your perspective on how important you think a vaccination program should be in the reopening of schools.
Well, I think teachers would like the added protection of being vaccinated. I think we all would like that. And I know there's been some discussion about moving teachers to a high priority group in order to get schools reopened quicker. And I think that teachers would support that. But I don't think that the majority of them are saying that I'm not going to return to the classroom until I'm vaccinated. As I said before, they're in teaching, not for the pay, but because they really are devoted to their students, and they really want to be with their students in the classroom, and they want what is best for their students. So they're always looking through that lens. One of the things that I just wanted to mention that was brought up by a teacher just this past week that I really hadn't considered, but I think it's something that might be an issue moving forward as more schools reopen. Some of the teachers have noted that there have been issues around the chemicals that are used to clean the classrooms, and they may be of things that have been used to clean classrooms, in the past, but I think the issue is that they're being cleaned more frequently. And there are people with asthma and allergies that are having reactions to some of the things that are used. And I would imagine, this would be a concern of students returning to those who have compromised immune systems or allergies or asthma or things of that nature. So I just wanted to bring that up as sort of another consideration, another issue that may arise as schools reopen, and we are cleansing our classrooms more deeply and more frequently than we have been before.
Sure, thank you. Dr. Akinboye, I wonder if you'd speak to what the relative importance is of vaccination for teachers in a reopening plan.
I think it's certainly important to include vaccinations as a part of the mitigation strategies to reduce the case burden in our communities and certainly further reduce in-school transmission. So we know education is already happening. It's happening virtually, and the question is around, can we come back in person in some settings? We've discussed the Swiss cheese model with the idea behind that, meaning that you're aligning different mitigation practices to ensure the holes in each slice of cheese doesn't line up. Those holes don't line up to allow COVID to go from an infected person all the way to someone that's not infected. In this context, a vaccine is another slice of cheese that would help with protective measures. So we know that even prior to us having the vaccines, we were able to see and experience in-person education safely. It would be hugely advantageous to ensure that a larger proportion of those that are returning in person are vaccinated. And I know a lot of states are working to prioritize educators, particularly those that are already returning in person or have plans to return in person shortly, so that we are further reducing those that may be infected and certainly those that would spread if they become infected.
Sure, that makes sense. Thank you very much. Okay, thank you again, everybody, for sending so many questions. We're going to crack on and get through as many of them as we can. And Dr. Zimmerman, I'll come back to you for this next question, which says that the CDC is supposed to release new guidance soon for reopening schools. What will you be looking for in the new recommendations? What do you think is needed that isn't in the current guidance to help schools reopen safely?
This is a tough question. I think that the CDC is likely to provide, additional information about masking and distancing. These seem to be specific questions that have come up, whether it's 6 feet, whether it's 3 feet. The WHO has used 3.3 feet or 1 meter roughly. So whether or not schools are able to do those types of things, particularly given the fact that or whether or not it's safe for schools to do those types of things, given the fact that hybrid models are they can be somewhat difficult. They allow people to have reduced class sizes, but it also means that it's not the most ideal thing for parents to work, for example, and thinking about childcare in the other settings. So I think those are things that might be part of the CDC's guidance coming down.
Sure, that makes sense. And from the same questioner, another aspect of that question was, what's an acceptable level of risk? Is it okay to open schools knowing that you may have a few cases? And I guess, as part of your mitigation strategies, would it be a suggestion that if you find out there is a case in the school, does the whole school shut down? Should it be just the classroom? Do you guys, what's the take on that?
Sure. I mean, I think we should remember that, people are getting infected anyway. Schools open, schools closed, regardless. Unfortunately, people are getting infected. I think there is some pretty good evidence from Mississippi that recently came out that really looked at students who were positive versus those who were negative. And this is a fairly high incidence community with more than 15% positivity. During the study period, they were able to identify that kids who went to school versus those who did not, and then kids who were going to parties and play dates, et cetera, the kids who were going to parties and play dates were more likely to be positive than those who went to school. So I think that is really the context with which we should be thinking about this. It's not, whether or not kids are going to get infected, people are going to get infected, is can we put them in an environment where there are kind of guidances and rules in place to help prevent transmission at really high rates. And I don't think that schools necessarily need to shut down if there is one case that comes in the building or a couple of cases that come into the building. We know that cases are going to come into the building. That's why the mitigation strategies are in place, because we're treating everyone as if they are actually infected. So doing things like cohorting, et cetera, allows us to have minimal exposures to those people who might actually make it into the building while they are infected.
Thank you, Dr. Zimmerman. Dr. Akinboye, another question here I'd like to address to you. It says that the ABC collaborative study reviewed data from 11 school districts in North Carolina that took part in hybrid instruction at the beginning of the school year when metrics were lower. Now, some school districts are hoping to reopen for younger students full time, despite worse metrics in the state and the confirmed presence of another variant. Are you concerned over a full return to in-person instruction for some students? And how can schools take the findings from your study to ensure a safe environment for staff and students now when conditions are slightly different?
A few parts to that question. I will start by addressing the question about the rates in the community at the time of the study. Absolutely, on average, we saw lower rates in the community. So we had about between 200 to 400 cases per 100,000 people in that population. However, when we parsed out our data, some communities that participated had case counts as high as 900 cases per 100,000 in the population. So what that means is we had communities that had low case counts, we had communities that had high case counts, and they all reported fairly similar data sets. The overall number of cases in the community would mean that the school district is dealing with more community cases that potentially could come into school. But with mitigation practices, and that's really the take home here, with appropriate mitigation practices, even in settings that had high community rates, we are still seeing low spread within the school setting. The conversation around variants certainly needs to continue. We're learning each day what the variants are, what that might mean, not just for transmission, but also for vaccination. We know that vaccines are an additional tool, and we want that to be a strong tool, and certainly don't want to get to a place where, due to variants, we're losing the protection we're supposed to get from vaccines. And that's really been our urgent concern. As far as I know, all the data suggests that the variants are slight mutations of what was circulating last year, but they're not mutating against masking and washing our hands. Those things still work. And I would go back to that as the take home here. We saw rising case counts and we still saw low spread in schools. We've seen variants and we know that's concerning for spread and vaccination, but certain things still work and variants are not going to change the impact of masking and hand washing and distancing in the school setting.
Thank you very much. That makes an awful lot of sense. We're going to crack on here through some more questions. Dr. Zimmerman, I would like to come back to you. We've had a number of questions regarding ventilation in classrooms and what's acceptable, what isn't. Some people saying that their school systems are just telling teachers to crack a window or open the door. Another question specifically about whether there should be a certain amount of cubic feet of air flow with fans. As part of mitigation strategies, ventilation in classrooms, how big of an issue is that? And are there specific recommendations that you guys would have?
Sure. So we know that even in the setting of poor ventilation, masking and distancing can be very helpful. I would go back to the Swiss cheese model that Dr. Akinboye mentioned before. Ventilation is potentially one part of the Swiss cheese model. So we want to make sure that all of our holes aren't aligning, right? So that's why there are many things that are in place to be helpful. What is most helpful is that ventilation systems work as if they were designed. Overhauling ventilation systems, HEPA filters, those types of things have not been demonstrated to result in reduced transmission. Certainly, we think that they could potentially work based on the fact that they're filtering air and things of that nature, but there is no evidence that reduced transmission has occurred because we have those things in place. So the most important thing would be to have ventilation systems that actually work. I know Dr. Akinboye has thoughts about this as well, and so I would be happy to have her chime in on this question.
Yes, I certainly agree with what you said. There's some evidence to suggest that ensuring your filtration and ventilation system meets standard, so not medical standards, just meet the physics, the engineering standards, would mean that the way air is circulating in that room would likely reduce the risk of transmission if someone is infected. But thinking through what we're saying here, it's important to even have source control. So if I'm wearing a mask, that already helps with reducing the number of droplets that potentially could circulate. The ventilation is an additive measure, but it's not the main thing. So yes, schools should focus on improving, or at the very least ensuring the ventilation system is meeting standards that have been put out by organizations that monitor and regulate these things. Opening a window or putting a fan has some additional consequences that should be considered. So what happens with allergies? What happens with the heat, or if we get into summer, what happens with cooling that room? And does it impact this ventilation system that you just worked so hard to improve? And does it worsen air circulation? So there is no one size fits all in every setting. Ventilation is important to be considered. Major overhauls likely not needed in most settings, just ensuring that you're meeting regulatory standards.
Sure, thank you both very much. Professor Stevens, we've had another question related to instruction, and what we want to know is when in-person schooling does resume, as we hope it will at some point, how important would it be, or would it be necessary for schools to do any remediation before picking up, where students left off? Because it's clear that doing remote instruction, some children have responded better to it than others, and there may well be some backsliding that's been happening. So what's your take on that?
Well, certainly, we'll want to kind of determine as best we can of how much, if any, learning loss has occurred. But what I would not like to see is us solely focus on remediation, because what typically happens when you do that is it's sort of the drill and kill. Children are uninspired. I'd like to see us get kids really excited about being together and learning together. And I think we can't just focus on remediation without also focusing on enrichment experiences to enrich students' learning and understanding around topics that engage and excite them. So I would say that we really need to tap into student interest. I hear a lot from teachers these days that are having a real problem engaging students in virtual learning, and even as they return to school, engaging them in learning again. And I don't think if we approach it from just, a remediation, we've got to get you up to speed and drill and kill and test, that we're going to inspire students to want to join us on the learning journey. So I think we've got to sort of temper that a bit with making learning enjoyable and fun for students again, to bring them on board in the process.
Absolutely. And I think we can all agree that drilling and killing students is a bad idea. Moving on, we've got another question here. And thank you again, everybody, for the questions. Keep them coming. We will certainly get through as many of them as we can. Dr. Zimmerman, we've got another question related to the ABC Collective study. And I would add for everybody, I've pasted the link to the website there in the chat, and we will include it in the media advisory that goes out to everybody who registered after this event. But one of the questions we had is what difference, if anything, you saw in spread between younger grade levels and older grade? Were there any measurable differences?
Sure. So let's see here. So we had all grade levels in the study and in the hybrid model. In our study, there wasn't substantial difference between the lower age groups and the older age groups, so that wasn't a direct that wasn't a primary outcome or primary endpoint for our study. And there were, so few cases in general spread out over all of the districts that it would be very hard to parse that out. So our study certainly cannot give a lot of information there with regard to lower or higher age groups.
Sure, that's fair enough. An associated question, and I'm not sure if the study addressed this, but you can let us know. Were you able to look at buses and travel? Because obviously so many of the children that go to school do so on buses, and these are various ages and various levels of ventilation systems. Did you look at that? And if not, is that something that you think should be part of, should be looked at as part of any return to school?
Sure. So, so buses were part of kind of the school itself. So it got counted into whether or not it was an exposure or secondary transmission or any of those types of things. So they were kind of all encompassed. We did not parse out whether you got it because you were exposed on the bus versus whether you were exposed within the classroom. So we don't have that particular information. We certainly know that, districts are thinking very hard and are working very hard to make sure that even transportation is a safe environment. So having things like, one person to a seat, making sure they're masking. Some places are having bus monitors to kind of reinforce some of the rules while people are on the bus and allowing the bus driver to actually drive the bus and not have to do all of this monitoring. Some people are taking temperatures, at the bus door and making sure that people don't have fevers when they're coming onto the bus. So there's a cadre of things that are happening that are highly variable, but schools are very much thinking about things like transportation and making sure that's also safe.
Certainly, thank you. Oh yeah, please go ahead.
No, I was agreeing with that and sort of emphasizing the question around distancing comes up a lot in transportation and carpools and how you get kids to the bus, stay on there for as long as they need. Some kids are in the bus for up to an hour. So of course that's similar to how long you would spend in a hospital visit or clinic visit, or say similar to what some kids are doing in the classroom. And so using the same mitigation that you're doing in school, in the bus setting or in the transportation that the kids are using would be important. And I just reemphasizing what Dr. Zimmerman said, the bus system is considered part of the school, and all the mitigation system practices should bleed over to the bus system as well.
Sure, thank you both. That makes sense. Okay, we're going to move into some more questions here. Dr. Akinboyo, I will stay with you. We mentioned testing earlier, and we've had another question come in that asks if testing's a part of a mitigation strategy, is there a threshold that school systems should use, and it's like the threshold that they should meet if they're going to rely on testing as a way of identifying and containing positive cases?
Is there a threshold about the % positive? I'm just asking for a quick clarification.
Yeah, sure. I mean, the question didn't specify, but I guess what they're trying to get at is there a certain threshold at which, as Dr. Zimmerman said, there are going to be people that are positive in the school. That's why we have the mitigation measures. But if outbreaks, say, are detected at schools, is there a certain level at which we say, okay, at this point, we should close the school, close the classroom? I guess, is there a certain number of positive cases at which mitigation strategies are not sufficient to keep a school open safely? Maybe that's a better question.
There may be. I don't know what that number is. I think it depends on where you're seeing positive cases. If you're testing every child that's coming into the school setting, you determine who's positive and you send them back home at that point, then presumably you're just picking up on community case rates. And that does not mean that the school setting needs to be shut down completely. If you're testing children to determine secondary spread or spread within the school setting, children, staff members, bus drivers, anyone that's involved in running the school each day, if that's the population you're testing and you start to see significant increases or clusters among that group, or say you're testing athletics and you see a large number of cases within the athletic department, it may be worth taking a second look, peeling back from certain activities that would increase contact, reevaluating all your strategies to make sure people are actually doing them and complying, and pausing certain activities until the case count goes down. I don't have that perfect number. I doubt that any study has been done to figure out that perfect number, but over time, we can likely determine that as we gain more experience with in-person education to understand what number would trigger aggressive metrics. But I think a pattern is important. There is not going to be one perfect number. Know what the population is that you're testing and use that metric accordingly.
Sure, thank you. That makes sense. We have a follow-up question, which Dr. Zimmerman, I'll come back to you on. And it says, how can we know whether there is community spread in a school when the outbreak in North Carolina, at least, is uncontained and we aren't testing often enough to accurately know how or exactly when somebody contracted COVID-19? So I guess that's another way of asking if testing has to be part, more stringent testing that we're seeing right now has to be part of mitigation strategy in a school.
Sure. So recall that evaluating community spread versus secondary transmission, this is an exercise in epidemiology, right? So you are evaluating what close contacts, like who your close contacts actually were, when you got symptoms, whether or not there are people at home. This contact tracing piece is actually very, very important to determine whether or not you were able, or whether or not this came from the community versus it came from, within the school, or it came from a party or whatever. So that is really the piece to identify whether or not things are coming from the community versus coming from within school. And we do contact tracing, in the community as a general rule. In schools, it has the potential to be even more robust, not only because people are super invested in doing so, but because who people were around, right? So you have a register of all the kids who came to school, all the adults who were there in school that day. And so have the ability to kind of understand that. And we do the very same thing in the hospital. There will be some cases where you won't be able to discern where they came from, whether it was from the community or from within school. But for the most part, in doing the contact tracing, thinking about the epidemiology, getting the story, that's the key important thing here.
And I'll add again here, we've seen the same data reflected in other settings. So we have a publication from an experience in summer camps from the Y during peaks of the pandemic. Sometimes there were low rates, sometimes there were high rates. We've seen it with daycare settings that follow mitigation practices and stayed open the entire year. They just never shut down because they were providing childcare services for healthcare workers or other essential workers. So it's not so much that we spent a lot of time on our study, but it's not just about the study we did. It's that a lot of groups have shown the exact same data set. We follow the data, and the data suggests that in-person education in the right context can occur safely. But that doesn't mean it's the answer for every community at all times. There's a lot of work that has to be poured into schools to ensure that they can do this safely.
Thank you both very much. And we have a follow-up, more of a clarifying question, really, Dr. Akingboyo, for you. And it says that the ABC collaborative study saw no difference in in-school transmission in communities with extremely high rates of COVID-19 and those with much lower rates. Is that true? And does that really reinforce that mitigation strategies work?
The latter half, yes. It is true that mitigation strategies work. The ABC collaborative study saw reduced transmission or saw minimal transmission in the school setting, regardless of community rate during the study period.
There's also data coming, there's data that recently came out from Wisconsin that showed the exact same thing. And they had cases, over 1,000 cases per 100,000 people per week, which is a substantial rate. And yet still we're able to demonstrate very minimal transmission within the school setting with the mitigation strategies in place. That's the key.
Absolutely. Thank you both. And a question that was a follow-up to a point that you guys made earlier about that schools are extremely good at enforcing rules. There have been the kind of somewhat mocking comments that schools actually, in a practical way, aren't as good as enforcing rules as we'd like to think they are, because, of course, kids are sprites and are here, there, and everywhere. So are there potential other factors involved in schools that are keeping the transmission secondary infection rates low, when we know that a large number of children in the same setting are not necessarily going to follow rules in the way that we would like them to? Are there other factors than just simply schools doing a good job of enforcing rules that are somehow keeping transmission rates low? And I realize that's more of a speculative question.
I'm happy to start that, and I'm sure Dr. 𝐏𝐚𝐧𝐞𝐏 would like to add as well. Whatever those other things are, I don't know what they are. We have seen and talk to superintendents and principals and teachers on a fairly regular basis. And I think, unfortunately, we don't give kids enough credit for the things that they can do. I saw a video of something happening in the school building in one of the districts recently, and it was so heartwarming. The kids were so excited just to be back in the classroom. They were wearing their mask. They were, distancing. The schools has all of the stickers and everything else to remind people, and they're making it fun. I think that's one of the things that Dr. Stevens has also mentioned, with regard to education, but also in this particular setting. Even watching my own kids, I think if you came within 6 feet of them, they would tell you to walk away. Kids, we don't give them enough credit. I think teachers and schools, they've worked extremely hard, and they're doing an amazing job at making this a feasible method of education.
I can certainly say that my son, on many occasions, as I've gotten out of the car, has reminded me to put my mask on when he already had his on. And Professor Stevens, I'd like to come back to you on that point. You talked about the need to make learning engaging for children when they come back, and for it to not be rote. And I think, what can you say about things that schools can do? As Dr. Zimmerman has already said, that there are encouraging things happening for kids to be really on board with the distancing, the masking, because of course it's key to make things fun for children, but these are also very important and high stakes. So what are some of the things that can be done to kind of help children buy into this, these new measures?
Well, I think the students, as was mentioned previously, are really taking responsibility for this, which is really good to see, and may need reminders from here and there. But I think one thing that's going to be important as we move forward is just really transparent communication between school and home, because parents also play a role in this, in terms of, speaking with their children about the importance of maintaining those mitigation strategies while they're at school, and why it's important, particularly for their family and for their loved ones. I mean, really personalizing the importance of it, as well as helping to protect others. So I think, building those relationships, and I do agree, we talked briefly a bit ago about, what happens if there is a case in a school, should the whole school shut down? And I think that this cohorting model of really keeping students, kind of in little insular pods, is going to make it more feasible. Let's say if there is an outbreak of some sort, of really pinpointing where that outbreak is. So maybe the whole school doesn't have to shut down, but it only impacts, students and teachers who maybe were in contact with that particular cohort or pod. So structurally, there's a lot of things that need to happen. And going back to the point about the ventilation system, I think ensuring that they work is probably the number one thing, because they don't all work consistently. Even before the pandemic, I hear stories about students, with their winter coats on in class because the ventilation or the heat isn't working. And likewise in the summer, the classrooms are 85, 90 degrees because the air conditioner isn't working. And there isn't hot water in many of our schools, nor is there soap and paper towels in many of our schools. So the resources really need to be in place. And I think having those resources will make everyone, parents and teachers, more comfortable with returning to school.
Thank you. And Dr. 𝐏𝐴𝐚𝐧𝐞𝐏, related to that, I wanted to come back to the comment you made earlier about the importance of acknowledging people's lived experience. And in this context, we know that whenever a return to in-person school happens, there will be parents and students that are very excited about it, and there will be parents and students that are very reluctant. And there will be a whole range of reactions to the mitigation measures. Of course, because of all the disinformation and misinformation, there are some people that don't think anything is necessary, and others who will be at the opposite end of the spectrum and going a lot further than the people at the norm. So what I want to ask related to that is, obviously communication is a huge part of this, and how in this kind of very strange post-factual world that's full of misinformation that we live in, can school systems best go about communicating to students and parents a consistent message when some people are gathered around that message and some people are far away from it in different directions? Because we'd like to think that just relying on facts would be enough, but of course in this day and age it isn't. So is there anything you can say about how we kind of get through to people, even though this seems a ludicrous question to ask, how we get through to people the importance of consistency around these things in order to be able to reopen safely?
I can share what I've learned from working with schools over the past year. I'm no expert in education at all. That is, this has been a learning experience for us as we try to navigate the best way to ensure we filter the noise and get data and information to school leaders to make decisions. And what I've learned through that process is that transparency works. And there's some people that no matter what you do, you may never be able to get through to them. And that's neither here nor there. But for the most part, I think people are looking for honest and consistent data or information around what's happening in schools and building back trust if that didn't exist before, or solidifying trust if it already existed amongst every single group, every family that participates in the school system. Some of that might be just being about as transparent as you can be around infections, so around cases, when they happen, what the cluster is, who it's impacting. I think schools have struggled with knowing how to protect health information, but also share enough so that parents, caregivers understand what the risk was, and if their child has a high risk of infection or sort of a low or minimal risk. And then following up with parents after a cluster occurs. How many cases did we see from this? How many secondary cases did we see? How successful are our approaches to some of these things? And then reducing the punitive measures associated with all of the mitigation strategies. We can't go back to, I'm not sure that we're ever going to go back to how things were. We're going back to a new reality. And that new reality should try to fix some of the issues that existed before around education, trust, and schooling. And certainly not just go back to things that probably didn't work as well in the past, and certainly wouldn't work in this setting where there's so much information floating around. Just the last thing, we have a long list of about 12 items that we think has been consistently reported from school leaders that has led to successful in-person reopening, and we can share, we kind of called it the 12 principles. It all centers around transparency, being upfront about what you're doing, how it's working, having data to analyze and share it, and considering that there are other areas you should pay more attention to. Our children with special needs, what things around music, arts, athletics, or other activities that may potentially increase the risk of infection.
Sure, absolutely. Thank you. We're getting close to time here. I'm going to cram as many questions in as I can before we leave. Dr. Zimmerman, I'll come back to you. This is, I guess, more of an immunology question. We tackled it in a vaccine briefing last week, but would appreciate your perspective. The question is, do we anticipate that the 6 feet distancing requirement will still be necessary even after teachers and adults have been vaccinated? What do we know about that so far?
So there is, I guess, less data certainly on 6 feet versus 3 feet. As I mentioned before, the WHO Europe uses 3 feet, and they have been successful doing that even without masking in a fairly low incidence setting. I think that the amount of data that we have regarding 3 feet and 6 feet will increase. We know that over the last month or so, schools here in North Carolina, particularly elementary schools, have gone back to and having a plan A, which is essentially, and they've done that 5 days a week, and so that's a number of kids within a school building, and they're not doing the 6 foot distance. And the preliminary data that we have from that suggests that we are still being successful in limiting transmission in that setting. We do know that for kids, vaccination is a bit far off. The trials of any kids less than 12 have not yet begun for any product that is currently available for adults, and supply continues to be an issue. So I think unfortunately we have more to learn about the question that you just asked, but I think the factors to consider are how successful are people when they are going back to a reduced number of feet between people. How successful are we in getting vaccinations out? When will vaccinations also occur for kids? Because they should, they're also going to be within this conversation about adults.
Sure, absolutely. Thank you very much. We are getting ready to wrap it up here. I have a final question that I'd like to address to all of the panelists, just to get your perspectives on. And it's a very thoughtful question here. Said that there's science and data, and then there are feelings of fear. And there are a lot of teachers who are very scared about coming back. Obviously, all of you guys in your capacities have dealt with teachers and talked to teachers on a regular basis. So the question then is, what would you say to a teacher that is very scared about returning to in-person schooling, especially if they haven't been vaccinated? And what can school systems do to be compassionate and understand the concerns of those teachers? And Professor Stevens, I'd like to get your thoughts on that first.
Well, I think that there are valid concerns that the teachers have. And the teachers that I work with, I would say that it's a small percentage of them really have these fears. But I think the school systems need to be responsive of those fears and to make accommodations, just as they're making accommodations for the families who are making the choice not to send their children back to school at this time. We have to understand that, this is a serious disease, and while the risk may be minimal for some groups, the fear is real. So I think that school districts need to look at making accommodations, and they certainly can, because if there's teachers that are scared for whatever reason, whether they have pre-existing conditions or they're a caregiver of someone who does, there are also children that need to still be taught virtually. And so kind of creating, a teaching plan that works for everyone based on what their needs are and what their desires are given the current situation.
Sure, thank you. Dr. Akinboyo, a final message from you to anybody that is especially frightened about returning to in-person schooling.
We've tried to come into those conversations to better understand where the fear is coming from. And some of them are based in true concern, and there may be data to help people shift off of those. But sometimes it's really not about data, and it's more about the uncertainty about the future. And that's hard to address because we all don't know what's coming. Every time we try to predict certain things, I think for the most part, people have been wrong. We never thought we would be dealing with this a year into the onset of the pandemic. And in that context, I think is sitting with the uncertainty, sharing what we do know and how other pandemics, other viruses, other variants have impacted spread in the past, and hoping that will help the person that's going through sort of fear and a lot of concern about potentially coming back in person. Vaccines will be helpful. I cannot overstate that it would be important to get vaccinations, our vaccination rates high enough to make this an easier decision for a lot of people. But just taking a moment to sit and understand where the fear has come from and hoping to address it where we can.
Sure, thank you. And Dr. Zimmerman, any parting thoughts for people with special fears about returning to school?
I think it's going to take time. I think, unfortunately, we're going to be living with COVID-19 for a while. And as more teachers get back into the building, talking to each other about their experiences, because a lot of this is fear of the unknown, like what could potentially happen. But I think we can have compassion for those people and understand that that it's going to take some time.
Absolutely, thank you. And I think we will leave it there. Thank you everyone for joining us. Thanks to our panelists, 𝐓𝐡𝐞 𝐏𝐚𝐧𝐞𝐼, Kanisha Zimmerman and Kristen Stevens for sharing your perspectives. We're having these briefings weekly, lots about the vaccine, obviously. If you'd like to be notified of upcoming briefings, please email dukenews@duke.edu. In the meantime, I think what we've reinforced here is that regardless of when schools open, regardless of what demographic you're from or what variants are swirling around, mitigation strategies work. Please wear a mask, stay distant, and get vaccinated when your turn comes around. Thank you very much for joining us, and please stay well.